Hello, good evening, and welcome again to 2020 Vision. I'm Jenny Fisher from East London News, and this is a programme where we try to apply some 2020 rational vision to a topic in the week's news. And the topic today is going to be the call for climate justice and health justice. When COVID began and the response to it, we all said, oh, things will get back to normal one day. And then people started saying, well, do we want to get back to normal? Or maybe if, sorry, I'm going to put my light on now so that there's a danger of you actually seeing me. Do we want to get back to normal, or are we going to create a new normal? And that new normal is going to have to include more action on climate change. And as the pandemic has shown us, more action on health. So tonight, after quite a few male guests, I'm very pleased to welcome two female guests, two fellow women campaigners today. And with us, we have Charlotte Munro, who has been putting together a meeting on health and sustainability for the Whipps Cross Hospital activists. That's actually not Charlotte, that's Anna. And Anna is from a thing called Green at Barts Health. Now, let's be quite clear, both of those guests, although they have things they're involved with, are speaking in a totally personal capacity and not on behalf of their employers or organisations or anything that they work for. So we're here just all speaking in a personal capacity. So, and Anna is adjusting her light so we can see her. Oh yes, that's even better. We can see Anna as well now. So Charlotte, is Charlotte actually there? She seems to have departed. Oh, well, in that case, Anna, we're going to have to begin with you. Don't forget everybody that you can actually call into the show and talk to us while we're here. Tell us what you know. Oh, hello, there's Charlotte joining us now. That's all right. You disappeared for a while. You can ring into the show on 0208 12345 07, 0208 12345 07, and add your 2 pence as we work out how we actually link these issues of health and general climate sustainability. So I'm going to just ask Charlotte, first of all, to just sort of run through for us, just give us a quick reminder. What you've got a hospital at Whipps Cross. Why are they building another one?
Whipps Cross Hospital was built originally in the Victorian time. So quite a lot of the proportion of the building is really old. Another big chunk of it was built in the 1930s. And then some more recent buildings. So I've worked in Whipps Cross Hospital for many years, and I'm an occupational therapist, and I've specialised in moving and handling, like staff safety. So my experience of working on those, especially the older wards, is there's very, very narrow bed spaces, which are totally really inappropriate for the needs of current clinical care and healthcare. So some of the just day-to-day practical problems of working clinically in an old hospital are you're trying to help somebody who's struggling to get out of bed, and you're sort of bumping into the person next door. And also, like, sometimes the doorways in some of the old wards are too narrow for the more larger specialist beds to get through, so patients can't actually be placed in those wards. Plus, it's a rambling big building that's, of course, been added to over the years, and so there's long patient journeys, or, for example, stores porters have to trundle stores across the roadways, and it costs a lot more to run because it's old. So all the additional heating that's needed, the energy that's needed to keep it warm, the maintenance. So it as well as our area, in my view, of East London being long-term underfunded for the population's need. In addition, Whipps Cross has got all those extra costs of having to run an old hospital, and that's why we really need a new one.
Yeah. So it must have been good news when they decided to build a new one.
Yes.
Then, but we need to now look at. I know your campaign group is now looking at the question of sustainability and how that as a theme runs through the provision of that new hospital, that new healthcare. And so let's bring Anna in at this point. Anna, you work for Green at Barts, or that's your campaign group. What is Green at Barts Health? What do you do then?
We're a staff organisation across all sites of the trust. So Royal London, Newham, Whipscross, and Barts. And we just
Anna, I'm not hearing you. Is everybody else hearing you? Charlotte, can you hear Anna?
I can hear.
Mm-hmm. All right, okay. It's probably just me then. Carry on.
Good.
That's better.
Brilliant. And we're concerned staff. So we're people who care about the environment, care about the threat that is climate change. The group was set up by Florence Wedmore and Tim Martin, who are a junior doctor and a nurse, so multidisciplinary from the start. A bit more than a year ago now. But very quickly we realised that the trust really wanted to hear from us on these issues. So we went along to the board meeting and just said, here you're building a new hospital. Can we hear about how it's going to be sustainable? And opened the conversation that way, really. But they've really welcomed us, and we've got all sorts of conversations going about all sorts of different things. So each of the trusts have to have a green plan, and we were asked to comment on the green plan for the trust. We've done a lot of work. Charlotte's led a lot of work on the building plan, the new building, and right down to things like one of our members wanted to know about how she might be able to recycle crisp packets, and so we put her in touch with the waste manager, and that's a conversation that's ongoing now. So we identified that a lot of this is about communications, engagement and education, and so that's another strand of our work that we want to really kind of promote, that this is everybody's job. And actually the net zero carbon report that was brought out in October has really shown us that that's what the leadership of the NHS is seeing as well. So they explicitly state that this is everybody's job. And so we see part of our role as bringing that conversation to the fore, really.
So is it just the building? I know on sort of house building programs on the telly, they talk about zero carbon neutral and so forth. Is it just the building, or is it going to go into the maintenance as well?
It's not. Well, if you look at the Sustainable Development Unit, which was set up in 2008, so this folks been going along for a long time with the NHS, and they've been carbon footprinting and kind of working out how to do that carbon footprinting for a long time now. And actually, it's 60% of the carbon footprint of the NHS is to do with clinical activity. So it's not to do with how much energy the hospital uses. We can't just solve this by putting solar panels on the roof. It's how we do healthcare. So I think that if that's the question you were asking, like, what do we need to do to get to net zero carbon? It's in our everyday actions. And it's not just about the water that we use. It's about what conversations we have with our patients, how we do healthcare in general. So do we carry on treating just the very, very advanced stages of disease with very high resource and financial intensive treatments, or do we start thinking about prevention? And that's in all the conversations that we have all the time.
Oh, don't get me started on that. Oh, well, actually, do get me started on that. That's the whole point. So, Charlotte, this you've been doing some work on the actual building side, have you? The sort of materials on that. I mean, is it just as simple as, let's get our concrete from down the road rather than from 30 miles away? Or
no. When we realised that we were really likely to get this new hospital, we thought, I thought, and a lot of other people thought, well, one thing that we can really contribute in terms of the climate crisis is that this hospital is as sustainable as possible and net zero carbon. So we kind of started looking into that, and we were net zero carbon is not just about where you source the materials, but that's actually quite important. It's obviously about how much energy is used in running the building when it's running, but it's also about all the energy and the carbon emissions that are involved in building the building. So sourcing things locally as far as possible, but also the manufacturing process, the mining, the excavation, and that's what's termed embodied carbon. And in a modern building, that will actually account for half or probably more of the whole life cycle carbon that's emitted for the whole life of the building. So it's and that will all be emitted within the next 5 or so years. So it's really important that the embodied carbon is looked at as well. And I know that, we have had a discussion with the sustainability advisors for the architect team. They came and talked to us in Green at Barts, because I'm involved in Green at Barts as well, and that's definitely one of the things that they're looking at. It's not a simple thing. They've got to actually look at, how much carbon is involved in all the different materials that are being used, and the impact across the world.
Well, I mean, that seems to me to be unprecedented. I mean, is this generally what happens when they build new hospitals? And Boris promised us a shed load of new hospitals, didn't he? Or 6 when he was questioned, something like 6, isn't it? So do you think, are they all sort of being done in this very modern fashion, or is it just something specific to East London that we've been able to push for it?
Well, we were certainly pushing for it, and I kind of imagine maybe us pushing for it has helped. But I think I just heard, and I'm not absolutely sure of the facts, that the NHS now is saying that all these 6 new hospitals need to be net zero carbon, which is very good if that's the case. But certainly, I mean, one of the things that our campaign group, Sustainability Action for Whips, did is they actually wrote to Matt Hancock, Secretary of State for Health, about Whips Cross, saying it needs to be an exemplar hospital on sustainability. And it's kind of, I think it's the most ahead of all those 6 buildings in terms of how far it's getting towards being built. And hopefully it'll be a pioneer.
I mean, it sounds like a pioneer. I think you should just claim the credit for leading the way already and just wait and see if anybody argues against you. Are your local MPs helping out? Because, I mean, one thing that I do sort of stress whenever I get the chance is that if you write to a minister and you're just a lonely individual not living in his or her constituency, your letter will probably only be seen by civil servants, which is often fine. But if you write your letter to your local constituency MP and ask them to pass it on to the minister and get the minister's comments, then the minister has to actually see the letter themselves. And so I was just wondering if your local MPs have been on board with this campaign.
We copied them into the letter and have definitely had support from them, and we're going to meet one of them for discussions actually this week on the strength of it.
Good. Okay, so Anna, healthcare. So you started talking about sustainable healthcare. I'm now old enough to have collected various conditions that leave me in a state of war with my general practitioner. Now, you're not a general practitioner; you're hospital-based, so that's fine. Sorry. What's your actual specialism, Anna? What do you do?
Respiratory medicine.
Oh, well, very, very topical. You must be horrendously busy. But I remember having a diagnosis of some new condition or other, and then being called in a fortnight later for my annual review, and having a stupid conversation with my GP administrator, who said, well, you've got to come for your annual review because you're on the list. That's why I've only diagnosed 2 weeks ago, and I was given a sort of thorough schedule of things to do. But I had to go in and have an annual review of what I'd managed to achieve in the previous year of 2 weeks long, within the previous 14 days. And when I finally saw my GP, he said, well, what's all this about then? He apologised for the fact that the surgery just had to obey government guidelines. So I think that's an example of sustainable healthcare. What's the point of dragging me in and using all their time when after just 14 days? And then to make matters worse, I did have a health issue earlier on during the closure period and phoned my GP surgery, and they phoned me back, and that was great. And so I was telling them about the issue that I had, and after a while I could hear her getting worried. You know how you can, when you're on the phone, you can hear somebody getting worried? And then she interrupted and said, I'm only allowed to talk to you for 4 minutes. And I thought, well, if you didn't drag me in to talk to you when I didn't have a fortnight's worth of annual review, then maybe you'd have more minutes. So that's my tragic story. Well, but let's go wider than that. How else can we do sustainable healthcare?
I think can we stay with that, because that's a hugely important thing that you've just raised. I should say, it's a disclaimer, I haven't been working clinically during COVID, so big up to my colleagues who have been. I've been working on education and been on maternity. And I think that what you've just described is an example of unsustainable and puffy healthcare. So one of the principles of sustainable healthcare is that we have lean systems. and that is not a lean system. So that's an as you've identified, an unnecessary appointment far too soon after the beginning of your diagnosis. And actually, why it doesn't make any sense for you to be coming in. It's a wasted journey for you. There's lots of information, really tragic information about air pollution levels around GP surgeries being very, very high. So the very places where we want to be healthy are unhealthy for us. And a lot of that is to do with patient travel, staff travel. There's lots of reasons why that would be. But getting someone in for an appointment which is just clearly not necessary because the system says so is crazy. So this is part of the kind of like reorganisation, the whole thing that we have to, this big, huge piece of work that we have to do to kind of really be rethinking what it is that we're doing here. What is our role as doctors, nurses, everybody, the whole bang shooting match of the healthcare service? What are we actually doing? Because what happened for you is that you were not at the centre of that decision making. So you as the patient, as the person, in fact, let's not talk about patients, let's talk about people. You were dragged because the system told you to go to an unnecessary appointment. Actually, if they listened to you as a person, what you needed, it would have been a completely different story, and that unnecessary appointment, that unnecessary journey wouldn't have happened. So yeah, there's lots in our system that has grown up over kind of decades of the NHS being there that is inefficient. And I think you could take various approaches to that. I'm not going to tell you that I'm a management expert and I know how to do this, but I think we don't look at it from the patient's perspective or the person's perspective enough. I think that's what, if we did that whole episode, because that will be being played out thousands of times a day across the nation, hundreds maybe, I don't know the numbers, but that's part of the problem. And there's these unnecessary letters that go, and you get a letter and you put it in the drawer, and then brilliant, okay, where's that letter? Oh god, I've got to phone. Oh no, I've missed my appointment. Or why are we sending everybody else emails? Why are we still sending letters on bits of paper? It's unuser friendly because nobody has bits of paper anymore. They all our calendars are online, but it's very rare that we have a system where you can think of another way of getting information across to your patient.
Yeah. I mean, letters are unwelcome in my house because they're usually bad news. But the most unwelcome are actually from my landlord, who will send you a letter dated a certain date, which arrives 3 or 4 days later because it's posted second class, and it tells you that you've got an appointment for a gas check. It's always a gas check. On the day before the letter was dated, telling you you're going to have had an appointment. It's a bizarre concept of time, which I think is creeping in.
Yeah, but I do think though that there's a lot of people, especially maybe older people, who need letters. I think we've got to be quite careful about assuming that everybody can use digital technology easily.
You make a really good point, Charlotte. But I think that then it's about the patient, isn't it? And what does the patient want? Do we have to have this system which is applied to everybody, or can we think about what it is that? And it's a good point. It's a very complex thing to deal with, but to not deal with it and to just carry on doing it because that's what we've always done is not. That's not how. That's not the way that the health service needs to move in order to get to net zero carbon.
I'll give you another story. I mustn't ramble on, but I will give you another story of my wonderful, wonderful pharmacist. And at the pharmacist, there's a delivery system, and there was a woman who used to go in quite regularly to collect her repeat prescription. And she eventually got frail and to the point where she had to be delivered to, and so the delivery people would pick up the prescription every 2 months, take the tablets round, and he noticed as he dispensed her blood pressure tablets, the dose was going up, the dose was going up, the dose was going up. So, but that happens in elderly people, but clearly the medicine just wasn't working. And one day there was a lot of delivering to do, and he said to the person delivering, "Don't worry, I'll just nip round myself. It's not very far, and I haven't seen her for a while. I'm very happy to deliver this medicine myself." And when he went in and had a nice chat with her and handed over her bag of medication, he noticed that there were some of his pharmacy carrier bags in the corner. So he said, "Oh, I'll take them back for you." And then he found they were all still full of all the medication. And nobody had thought to check whether she was taking the medication they just kept upping the dose, and she kept filing it on the armchair and never taking it. So
and that's ridiculous. And there's a huge waste. So we waste, I think it's £300 million a year in the NHS on pharmaceuticals kind of just not used. It's a huge amount of money. I actually surprised it's not higher than that. I think that's the number. I'm not very good at keeping numbers in my head, but it's massive. But what about when she does go, if she has to go into hospital and her GP, we get the GP prescription and we put her on this blood pressure medicine, and she's maybe a bit poorly anyway because she's got a UTI or something, and we give her that. It's going to put her blood pressure in her boots. So it's unsafe as well. It's really, those people are very vulnerable. And that's a very common story. And we just assume, because we've got this approach that drugs are the answer, more drugs. And it's not, that's a very expensive and very resource intensive way of dealing with problems that are often dealable with other means.
Yes, but it also shows you how useful pharmacists can be.
Absolutely, and I think this is another massive strand to this. We think that doctors do healthcare, or often doctors think that doctors do healthcare, and I'm speaking as a doctor. And to not involve our multidisciplinary colleagues, I mean, there are lots of really good examples of where multidisciplinary teams work. Medical education is not one of them. We don't have multidisciplinary learning. I know of many medical students who've come to the end of their 50 and they have no idea what their dietitian colleagues do. They don't. We don't have that kind of team shared understanding often of what each other's jobs are. And I met an occupational therapist, I'm sorry, Charlotte, who said, I need to come and tell you what an occupational therapist does. This was quite recently. It's painful, but it's the way the system is organised at the moment, and it's inefficient and bad for patients, bad for people, bad for the people who are working in the system as well.
Well, how does this sort of idea of sustainable healthcare, patient-driven healthcare, affect occupational therapy, Charlotte? I don't know who these days gets occupational therapy. Is it the same as physiotherapy, or is the specialism quite different?
Occupational therapy is a different specialism to physiotherapy, and its focus is on meaningful activity and occupation and helping people to reach their potential and their goals that they want to reach through either using activity to help people to actually regain some ability and regain some function and get better, or finding other ways of achieving what they want to achieve, like equipment, like simple things like if you can't reach down to get your socks on, there's kit that helps you get your socks on without bending down. But much more than that, occupational therapists, we look at people's home situation to see, is that safe? And we work in mental health, we work with children, we work with adults, we work in all sorts, every field basically. And our approach is very much person-centered. We find out what people are trying to achieve, what they want to achieve, and then help them to find ways that they can, with our particular knowledge of their condition and how other people have overcome those problems.
Well, that does sound
very person-centered.
And it does sound very much sort of a case of sustainable healthcare. Yeah. I mean, what are you actually looking for in the new Whoops Cross Hospital, Charlotte? You mentioned more bed space and perhaps more rational approach to the different buildings, but what are your sort of key pointers?
I think I know one of the general aims that's necessary is actually getting departments that need to be near each other, so you don't have to travel miles. So it's all fairly logical. But especially from a sustainability point of view, well-being of the people who use the building is actually a very important part of what's classed as sustainability. And if you have a building which, for example, has lots of natural light, where the patient's areas, where if you're ill, you can look out onto trees, you can look out onto greenery, you can look out onto the clouds in the sky. That's actually known to help a patient to recover. So there's this quite seminal study that was done in the 80s that showed that patients with exactly the same operation, one group of patients looked out on waving trees and leaves, and another group of patients looked out on another building with just a brick wall, and the ones who looked out on the trees actually healed a day earlier, needed less pain medication, pain control, and had fewer complications. And that's like knowledge has been, well established. So that's really important. But also another thing that's really important is for the staff themselves to have, for example, access to daylight and windows and views outside as well. And other research has shown that like office workers who work near a window or have access to a window in their normal daily work sleep about 46 minutes on average better than compared to office workers who just looked out with no view or far away from a window, and were generally sort of more lively and healthier. So something that's really important to, I think, all of us in Green at Barts and other people who've been talking about it, people have had experience of working in offices with no windows, and I think like a lot of the staff areas, say in the Royal London Hospital, which is a big new hospital, don't have access to outside windows and views. And we really, really want that to be an important feature in the hospital. And so that the experience of being in a hospital is a very health-giving experience, whether you're working in it, for long shifts, day after day or night after night, or whether you're a patient in there and going through difficult traumatic time, or whether you're a relative who can also be going through, a friend who's can be going through difficult times because somebody who's very close to you is near to dying or going through a critical phase in their health. And so the design of the hospital and the fabric of the hospital to make sure that it's like healthy inside is really important. Things like being able to open a window and get fresh air. And the other thing I think that's very important in terms of well-being as well is one thing is active travel. So I know the architects are talking about that, is like having attractive staircases that are near to the lifts, so you can find your way. So you've got a choice, if you're well and fit enough, to choose the stairs and keep yourself fitter rather than always using the lift. So sort of active movement within the hospital, good areas to congregate. The long Whips Cross corridor is a brilliant place for doing business. You meet people there, you just stop and chat, and it'd be really good. I think they're talking about looking at how that, not the long corridor, but that kind of equivalent passing space, casual meeting space, can be recreated within the new hospital. And the other thing is the green space outside. There's so much research now that shows the benefit of human beings being in the natural environment, and that gives relief from stress. It actually lowers your blood pressure. Being outside for 5 minutes or so can actually lower people's blood pressure, reduces stress. And there's a really interesting study, and this is one of the people who's going to come and speak at our public meeting, by the Centre for Sustainable Healthcare, exactly into NHS staff and using green spaces and the benefit of having green spaces near to where they work, that they can just pop out and sit outside in, or have a meeting outside, or go for a short walk.
I think that's important to all of us, isn't it?
It is.
I think we're discovering that during the lockdown, that those opportunities to work in a more relaxed manner, including popping in and out, are really helpful. Before we get on to the public meeting that's coming up, and which is a bit of one of the drivers for the show, the Royal London Hospital, of course, is relatively new, and many of us have had problems with its design and build because of the overall loss of beds, the overall loss of additional units. I've been inpatient in the London Chest Hospital, and that was really good. That to have a hospital with a specialism like that. And I know some women, who've given birth at the Hackney Mothers Hospital, going back, have said the same thing. But on the other hand, I have got so lost in the London hospital, looking for where I'm supposed to be and where I'm not, and gone round in circles. It's very difficult to find your way around sometimes.
You and me both, working there. quite often,
Sorry? Yeah.
you and me both, working
Yeah.
at Royal London Hospital, you get lost. So I've
No.
been on wards, and I've quite often, one of the commonest questions is, which ward am I on? And you have to look around because they look the same. It's the most disconcerting thing. You can't open the windows. There's no green space. There was some green space, but it went. The corridor, as Charlotte described, the staircases are bare concrete with no windows, no natural light. It's just a well of concrete, and so nobody wants to spend their time there. They did do a challenge where going up to the 17th floor or whatever, but why would you do that? There's nothing appealing about it. So that design is not of 2020.
I mean, can anything be done about that retrospectively? I suppose. I mean, didn't the Royal London make a big thing of? I still think of it as the Royal London rather than the Barts Trust. Didn't they make a thing about putting art up around the corridors, and that was supposed to make us all better and help our blood pressure?
There's some really nice art along the corridors, and Vital Arts do a great job. That's the arts organisation, but it's largely patient facing, as far as I can see. There's not so much kind of staff art stuff that I know of, but I might be misrepresenting them. So yeah, I think, and there are pockets of really nice things. So on the 14th floor, there's a garden room, which is lovely and green, and that's where the patient elderly care unit is. So patients with dementia, delirium can come and be in a kind of nice green space. And there's a garden for the paediatric unit as well. I think it's up high. But apart from that, it just doesn't sound like it doesn't fit with what Charlotte's been talking about with the plans. So it's really great that this is now being looked at in a different way.
Is that paediatric unit the one that mopped up the service that used to be delivered from the Queen Elizabeth?
Oh, I don't know. I'm sorry. I'm not sure.
It used to be a hospital called the Queen Elizabeth Hospital for Children. It was technically, I think it was on Hackney Road, and I think may actually have just been in Hackney, but I think also served a lot of Tower Hamlets people. I am a mother, so yes, I've been there. And then when that hospital was closed, I think the idea was the Royal London would mop up, would deliver the service, and that's a bit sad, really, if it's at a high level. It just feels so different, doesn't it?
It definitely pockets, so it's not for all. That's the thing. I think if you work there as a run-of-the-mill person who doesn't have a special ward with your garden area, then you don't get it. No. And the outside space, we briefly had a member who looks after the planters outside A&E. She puts a lot of work in, but it's all her own time, all her own plants that she brings in. So we've got a long way to go, and I think you were talking about Charlotte, who's speaking at the meeting, isn't it? So that's
obviously time to move on to thinking of the meeting. You're having a meeting on well-being and health and sustainability, which is one of gave us the idea for having this chat, really, Charlotte. I mean, but how did the meeting come about? I mean, obviously you've done the work on sustainability. How did you make the link then with sustainability of health care, health justice, and climate justice?
Well, the group of people came together following an online meeting held by Wolf and Forest Save Our NHS about the new hospital. And one of the presentations, the speakers I gave about sustainable building, with the view to the new hospital. And a lot of people emailed the organisation saying they were really interested in getting involved, and particularly involved in the sustainability side. So we got together as a group of people, which includes mostly local residents, local GPs, healthcare workers, hospital workers, and I think we wanted to kind of get a really good discussion, more in-depth discussion going on the things that we wanted to see in the new hospital from a sustainability point of view. And it just, I mean, well-being is now considered very much part of sustainability, but it just happened that the first people who offered to say, yeah, they'd love to come and speak, that was their specialist area. So then we kind of developed a focus on it with the other speakers as well.
So what have we got to look forward to? There's a meeting coming up. Is it Is it Tuesday the 24th, your meeting?
It
Or have I
is.
got that wrong? Oh, right. Oh, good.
Tuesday is a week today at 7 o'clock, running from 7 in the evening till 9 in the evening.
And it's one of these Zoom meetings, I
It's
take
a
it.
Zoom meeting, yeah. It's a Zoom meeting. And you register on Eventbrite. So
maybe if we could just see the slide, and we have got a little picture, which I'd quite like to show people. That's the one. I just want to show people so that it's quite a sort of striking picture, and so when you find it on Eventbrite, then you know you've got the right place. So that's what it looks like, and that's how at the top of the registration form. And even I've actually registered to go to the meeting, so it can't be difficult at all. So get on Eventbrite, look for the Sustainable Whipps Cross Hospital meeting, Building for Wellbeing, 7 o'clock next Tuesday, and just click and register, and then remember actually to watch it as well, because I must admit registering is often easier than remembering to watch these meetings. But and who exactly? Thank you for the slide.
Yeah, we plan to send out a reminder email to people just before. But who we've got speaking? We've got a range of speakers. We've got Dr. Nadia Odhali, who's actually part of a Green at Barts group, and she's a paediatric doctor at Whipps Cross Hospital, and also a clean air champion. And she's going to sort of put the thing in context of like the climate crisis is a health crisis. And then we have another doctor, Dr. Rupert Jaiswal, who is a London GP, and she specialises in what's called lifestyle medicine. She's a lifestyle medicine physician, and she's actually the regional director of London of the sort of British Society of Lifestyle Medicine, and that's all about like how the way we live, the environment we live in, and behaviours affect our health. It's not just about medicine, a bit like what Anna was talking about. We've also then got a speaker called Julie Godfrey, who works for the Chartered Institute of Building Services Engineers, and she was the author of their technical guide on health and wellbeing. So I think these are the guys who like install heating and that kind of thing. So the professional body for them. She's going to talk. And I've heard her on YouTube, and she's quite a lively, enthusiastic speaker. And then we have Kerry Newson, who is from the Centre for Sustainable Healthcare, and she led that research. They did a year-long research that they've just recently reported on, about the benefit of green space for NHS staff, and they come up with some really useful practical guidelines on, because they also looked at the barriers that stop staff using green space, and so I think it's all incredibly relevant to the new Whipps Cross Hospital. And then the final speaker is Paul Bell, who is the lead architect, and he's from Ryder Architecture, who are the architects for the new hospital. So he is the lead architect for the new Whipps Cross Hospital. So he's gonna hopefully pull everything together and say, well, this is what we can do in the new Whipps Cross, and talk about where they've got to so far with their kind of early design plans. And then there'll be discussion. Lots of time for questions.
As I say, I mean, as far as I can see, this is such a trailblazer, such a pioneer for a national programme of hospital building. So I do very much hope people will register and then work it through, because we haven't really mentioned COVID much this evening, but it really has shown us, hasn't it, of the need to tackle climate change and the need to tackle health justice as well. So, I mean, are there any other topics around? Where do you think this could go next? I mean, this is building a hospital, but in this massive NHS trusts that we all live under, with its financial problems, with its challenges outside. I mean, I remember once talking to a professor who should definitely remain nameless, because I've forgotten what he was called. That's not a problem. I happened to be talking to him about local people wanting to become doctors and how this might happen. And he's like, local people become doctors? I don't think that's quite right, is it? And I was like, oh, well, you want this just to carry on being ill then, to keep you in work, you know. There was a bit of an us and them situation going on there. But the population that these hospitals and GPs and this whole structure serves is living in conditions which are deteriorating and probably affecting their health as well. I mean, is there any change that the NHS could make to actually address some of those issues? Maybe more partnership working or more awareness about the sort of social causes of bad health? Anna, have you thought that through at all?
So I hope that that's coming. So there's a really exciting project going on in North East London at the moment, which is bringing together secondary care, primary care, and the borough, the council, the many council, and it's across the Barts Health footprint. But there's people from multiple organisations working together to create an anchor charter, an anchor organisation, which is understanding that health is everything. And so I went to a meeting of that, which is it's being organised by NEL. I'm not totally sure, it's terrible, of the kind of like overriding organisation who totally overseeing it. But there's lots of organisations, lots of different people involved, and it's great. And one of the main topics of conversation last week, even though it was a kind of primarily a health related thing, with public health team from the Royal London, for example, was there talking about jobs, because jobs is to do with health, because it's to do with social capital, it's to do with good jobs, as you say, like the local people, they can't be good, like that's just obviously nonsense, isn't it? And so, but how do you get that? And I think our focus at the moment is that we treat the blood pressure, or we treat the kidney failure, or we treat wherever it is that we see in front of us, and we don't think about everybody, the rest of the life that is held, that is going on all the time out when they walk out of the room or the A&E or wherever it is that we're seeing them. And that's why I've got this for me, and I, with my teaching, really keen that we talk about patients as people, because if they're patients, then they exist in the hospital. And if you say to medical students, where is your patient? They're like, well, they're on the ward. And that's where they exist for us. And I kind of realised this myself a couple of years ago. I was kind of doing a discharge summary, and I suddenly thought, they're only for me. They just pop out of existence as soon as they leave the hospital. But I was trained into that. We train people into that. And so this is a huge part of this problem, is that we don't understand what the rest of life is that's going on, and that we don't have those organisational links. And I think you make a really good point that if we start understanding that the vast majority of health is to do with social problems or social factors, then we can start to sort these problems out. And there's loads of great work going on. So there's the Bromley by Bow Centre who have a reputation for social prescribing, but in fact really understand that the social part of all of this is the biggest part, and that the medicine is the little bit. But there's all sorts of kind of, I think, societal values applied to doctors, to healthcare professionals, because they're the ones that do health, and that's for me not helpful.
Yeah. I mean, this discussion must impact on OT.
I was going to, well, aside from talking about OT specifically, I think that if we're going to get into a position where we can prevent people from deteriorating, becoming ill, as well as having all the kind of life factors that help people to stay healthy, like jobs, like income, we also need to make sure that people have access to healthcare in a timely way. And I think a lot of the problems the NHS is facing, or the people trying to access healthcare in the NHS, is that it's constantly under so much pressure that often people can't get seen as early as they need to be seen, or can't get the interventions as soon as they would benefit from. And then, it can actually lead to tragedy. And obviously, like during the COVID pandemic has brought that to the fore in a big way. So there's like a huge number of excess deaths that we're hearing about recently, but also a lot of people then have not been able to access treatment, which has nothing to do with COVID, because of the pressures. So I know there's a big sort of struggle within the NHS to try and catch up. But the problem is that we hit these big crises in a situation where people are constantly operating under a crisis because of the lack of resources. And I think, if everybody's seeing the huge value of the NHS in our society and how we value it, well, that has to then become a real a real economic and political thing that this takes a priority in terms of what we invest in our society, that so that we can move away from this constant crisis management and things like the new hospital. That it's going to need more funding than what we understand is getting from the government in order to be the best that it can be for future generations. We can't afford to let an opportunity like this be squandered through penny pinching from the government and things like that. So there's I think a lot that needs to be done to improve things in the NHS.
And the health crisis that's coming as a result of climate change is going to swamp what we see from COVID. The health crisis is going to be absolutely enormous. And
why is that, Anna?
So there's lots and lots of reasons, and it's really difficult to kind of get it down in a few things. This is why I struggled until quite recently with what this all means. It's very interlinked. So there's examples of, if you take one example of heat, extreme heat, has a really significant mortality attached to it for vulnerable people, but also even those not vulnerable people, you see violent crime going up. You see all sorts of increased A&E admissions with heat events as well as with cold events. And at the moment we understand that cold is bad and that winter's pressures are bad, but cold and heat are happening at the same time now in a way that they weren't. Air pollution is another huge part of this. Then we're going to see the kind of mental health crises of the ecological breakdown that's coming, and I think already impacting on people. So eco-anxiety is a recognised phenomenon. We're going to see migration massively increased because parts of the world are going to be uninhabitable. And so there's loads and loads of knock-on events. But the biggest thing about this is that actually, if you act on climate change, you act on health quite quickly. So if you reduce the amount of meat you eat, if you reduce the amount of dairy you eat, you improve your health immediately. If you get out of your car, if you are able to, if you use more active means of transport, you improve your health straight away, not just by being fitter, but by not sitting in air pollution, because cars are associated with air pollution. If you're sitting in a car, you're exposed to more air pollution than you are outside.
Oh, dear.
Next to the car. So there's all sorts of things they're very simple, but they could have a massive effect. And I'm not seeing the messaging from powerful people on this. But I think this net zero report is a really good thing, because I think that is going to lead to more messaging. So there's two reasons to do it. Firstly, that it's going to have a massive impact on our health. Secondly, it's good for our health already to do it. And we as healthcare professionals should be leading that.
Yes, well, I think sorry, go on, Charlotte.
No, I was just going to say it's really important that people understand that and aware of it. And I think we all experienced during COVID, like the lockdown, in the first lockdown, the sort of transformation of the air around us, because there was much less traffic. But buildings account for about half the UK, just under half the UK carbon emissions. So if we can transform the way that buildings run and are built, that will make a big contribution. And we hope that what happens in Whipps Cross will inspire other building projects as well. And
very much so.
A real transformation. I mean, the other thing is that we need the hospital to be big enough as well. We need it to have the capacity and not to be under pressure, so staff aren't constantly under pressure.
Yes, well, I think it's been, we need to begin to sort of draw to a close now. But I think it's been a real treat to have two such expert guests. It seems unlikely cohabitation, climate change and health change, climate justice, health justice. But I think you've both proven that it is exactly the kind of link that we need to make and that all the signs are telling us to make. I went out for a little walk today, and I was just looking round at Tower Hamlets, which we often think of as the tower part of the name. And we're always getting new towers built in Tower Hamlets. But I think we're losing a lot of sight of the Hamlets part of the name as well. And our hamlets that existed in between the towers used to be real communities that really looked out for each other. And I'm sure that had a big effect on health outcomes as well. And I think we're just losing it all as we become this vast modernist Lego-like, sorry, nothing against Lego, but the vast monopoly of towers and like a huge dormitory. And I was just looking at 2 new tower blocks that were being built next to each other, and I thought, that's an older one that's been there. The people living there must have been delighted at the view and everything, and now their view is just the tower block next door, and it's almost like, you know, tower blocks have ceased to have a purpose.
Yeah.
Just vertical dormitory. Sorry,
And
Anna.
I was just going to say that appreciation of our built environment and our where we live, and that having an impact on our health. I just kind of, it occurred to me suddenly. So we've got this whole rhetoric and conversation about the fact that being in green space is good for you. So it's a positive thing that if you go to a wood and do some walking, your health will improve, your blood pressure will go down, whatever it is. But we don't see it as not being in green space is bad for you. So it is a negative health impact. And it's going to be the same as it should have the same label as smoking, as eating poorly, as all the rest of it, as air pollution, because it's got that bad effect on you. But we don't see it like that. We see it as an additional thing that you can do that's a good thing. So I'm really interested in kind of like just spinning these messages and seeing things in a different way, just like trying to kind of reframe conversations. I think that's what we need to do in order to have an impact.
Yes. Fantastic. And so, dear viewer, help us spread that message out, and let's see if we can make a break. I mean, at least we can cheer ourselves up with the result of the US election, so it seems that anything is possible. But at the same time, what we've got to stop is using our health service and our other societal activities as a way of channeling public money into private pockets, a topic we haven't even had a chance to address tonight. So give us one last reminder of the public meeting coming up, Charlotte. It's next Tuesday.
Yeah, it's Tuesday the 24th of November, next Tuesday, and it starts at 7 p.m. And if you Google, I have this here. I'm not that you can really see it, but basically, if you look up Eventbrite and Building for Wellbeing for a Sustainable New Whips Cross, if you search that should come up. And actually, one other thing I would really do want to say, which is also go onto the Barts Health Trust website and look for future whips. And they're currently, the architects are currently running some workshops to get people's views and experiences on all sorts of things like the healing environment and finding your way, exactly what you're talking about, finding your way around the hospital. So to try and get people's actual experience and what they're hoping for within the hospital. So do have a look on that website and register for some of those workshops. They're running now right up into December.
And a last word from you, Anna. Anything to add to what you said, or anything you haven't quite got in yet?
We are thinking about adding a sustainability page to at Barts Health, so we're going to have a bit more communication about that. And if there's any health professionals out there, then do join us in Green at Barts Health. Welcome to join from the primary care sector.
Yes, that's. I mean, sorry, that's green at anywhere in the Barts Trust, NHS Trust delivery area, not just at Barts Hospital.
Yeah, we're really keen that we don't just have these conversations in secondary care, because what we were talking about before happens. So great to have a cross-border thing.
Fantastic. Okay, that's
thank you very much.
Yeah, thank you, Jenny.
Thank you very much.
Excellent start. I hope we can carry on discussing this again. But for now, we're going to, with no time for the local headlines, do look at your council's website. Just run through them very, very quickly. Tower Hamlets has got a consultation on changes to the support they give to adults in social care. That looks like it's important and very much part of what we've just been talking about. Redbridge has started a local lottery to raise some local funds, so get onto their website and have a look. And Newham has warned that there's people going around trying to scam people. That's something to watch out for. If you get contacted and asked to provide your bank details so that people can pay you a council tax support, be very careful. That's a well-known scam that's going around at the moment. Hackney has got Alcohol Awareness Week at the moment. Nationally, 1.35 people in every 100 are dependent on alcohol in Hackney. That looks like it's nearer 2. So they're doing some work on alcohol and mental health. And Barking and Dagenham have just got COVID marshals. That's the only news from there. But keep in touch with your council website. Thank you very much for watching tonight. If you've enjoyed the program, then do share the link and let your friends know about it, because you can watch this program as a video on demand. Otherwise, we'll see you next Tuesday at the Wellbeing Meet and Sustainability meeting, and then afterwards later in the evening with a new 2020 vision for next week. So thanks for watching, and for now, good night.